Welcome to Pathology Pebbles. I am Dr. RV. Let's learn white blood cell WBCs. WBC, also called as a leukocyte, are produced in bone marrow, and these are the cells of immune system so that fight with infection, viruses, and bacteria. Normal WBC count of adult is 4,000 to 11,000 per cubic mm. In children and in infant, ranges up to 20,000. WBC classified on the basis of presence of granules in their cytoplasm. So granulocytes are neutrophil, eosinophil, and basophil, while agranulocytes are lymphocyte and monocyte. Let's learn how to identify this cell on the peripheral smear with important viva questions. Let's start with most important cell of our body, neutrophil. It has a 3 to 5 lobated nuclei and fine purple granules. So we can appreciate small little fine purple color granules. In this picture, we can also appreciate disc shape with central 1/3 palar RBCs and small platelets. What happened when there is a lobe more than 5? So it is called as a hypersegmented neutrophil. So whenever nuclei with excessive lobes means 5 or more lobes in more than 5% of neutrophil, or any one neutrophil with 6 lobes, it is called as a hypersegmented neutrophil. It is seen in megaloblastic anemia due to the vitamin B12 or folic acid deficiency, myelodysplastic syndrome, and after chemotherapy. Increase in neutrophil count, called as a neutrophilia. Causes are bacterial infection, post-surgery, acute blood loss, burns, chronic myeloid leukemia, and polycythemia vera. Decrease in neutrophil is called as a neutropenia, and causes are drug-induced autoimmune disease like SLE, typhoid fever, viral infection like HIV, parvovirus, ABV, malaria, kala azar, and myelodysplastic syndrome. Moving on to the another granulocyte, it is a beautiful eosinophil. It contains 2 or the bilobe nuclei and coarse means large orange red granules. Increase in eosinophil count is seen in allergy, asthma, hay fever, parasitic infection, eczema, and mastocytosis. Also seen in chronic eosinophilic leukemia. Moving on to the lymphocyte, it has central to acentric nucleus, rim of pale blue cytoplasm, and chromatin is dark and condensed. Causes of lymphocytosis is tuberculosis, infectious mononucleosis, mumps, syphilis, measles, and toxoplasmosis, also seen in viral infection. While causes of leukopenia are radiation, post-chemotherapy, HIV, and cytotoxic drugs. Moving on to the monocyte, it is also known as a phagocytic cell because it has important role in a phagocytosis of the immunity. It has kidney-shaped nucleus with pale grayish-blue cytoplasm. And also it has vacuoles, so we can appreciate clear spaces in the cytoplasm. Causes of monocytosis are infections like TB, malaria, kala azar, ulcerative colitis, and Crohn's disease, which are the inflammatory bowel syndromes, sarcoidosis, SLE. And also it increase in chronic myelomonocytic leukemia. While monocyte decrease in aplastic anemia, steroid therapy, hairy cell leukemia. Moving on to the last cell, basophil. It has multilobated nuclei which are partly or completely covered by the dark blue color granules. Causes of basophilia, most common is CML or the chronic myeloid leukemia. Also it increases in polycythemia vera, acute basophilic leukemia, and mastocytosis. After this learning, I hope it easy to identify all the cell in peripheral smear. So in this image we can appreciate neutrophil, eosinophil, basophil, monocyte, lymphocyte, and in background of RBCs. If you like the people, share and subscribe. Thanks for watching. Happy learning.